Laboratory design. The role of the administration in the design of the laboratory and in the management of the facility. The responsibilities of the administration are discussed under various headings subsequently. General considerations. The administration must ensure that the laboratory has adequate space for optimal functioning. If an existing laboratory does not have sufficient space, then the administration must provide additional area for extension. And if a new laboratory is being set up, then the floor plan must allow for adequate space in the laboratory. Utilities such as continuous uninterrupted power supply and water supply must be taken care of for proper functioning of the equipment and for convenient working of the laboratory staff. The administration must provide for temperature control, air quality control, and adequate ventilation in the laboratory. The administration must act and update based on changes in the policy. Continuing with general considerations, focusing on the laboratory personnel. The administration must meet the overall manpower and resource requirements. They must hire adequate number of staff to work in the laboratory based on the IPHS or the Indian Public Health Standards so that the staff are not overworked. The health and safety of the laboratory personnel must be kept in mind at all stages of planning. They must be monitored periodically to detect and rectify gaps. The management of the laboratory personnel must include annual or periodic evaluations and assessments for promotion and other benefits. It is important to manage the laboratory staff appropriately, as a happy worker performs a better job. The administration makes most of the financial decisions for a laboratory. The procurement of good quality, appropriate equipment, consumables, and reagents from a reliable vendor, therefore, is the responsibility of the administration. During budget planning and allocation of funds, the expenses towards ensuring the safety of the staff, patients, and the environment must be kept in consideration. There must be funds allocated for contingencies like outbreaks in the hospital or the community, and for other natural or man-made emergency situations. Safety. The laboratory and the hospital must have a safety policy and a designated safety officer. The administration must ensure that the institutional safety policy adheres to the state and the district policies. Adequate and appropriate personal protective equipment must be made available at all areas of work and must be accessible to all employees. There must be a provision for post-exposure prophylaxis and immunization of healthcare workers. Safety audits must be conducted regularly to assess the knowledge, attitude, and practices of the staff and the efficiency of the safety systems and safety equipment placed in the laboratory. There should be restricted entry into the laboratory working area. Nobody, apart from authorized personnel, should be allowed into the laboratory for the safety of the staff, specimens, testing equipment, and other materials. Training. The administration must ensure that there are periodic and calendared trainings for all the laboratory staff. The topics of the trainings must cover all aspects of laboratory service, from diagnostic testing to quality management systems. Records of attendance in the training and the topics covered must be maintained. And there must be a system to evaluate the effectiveness of the training. The easiest way to do it would be to conduct a pre-test and a post-test immediately before and after the training respectively. Intramural interactions or interactions within the healthcare facility. There should be continuous engagement of the higher management in the laboratory activities. MRMs or management review meetings should be held periodically. The appointment of the laboratory administrative head, the technical supervisor, and the quality manager of the laboratory is another responsibility of the administration. Extramural interactions or interactions and linkages outside the healthcare facility with government and other regulatory bodies such as the pollution control bodies, the Atomic Energy Regulatory Board, emergency response bodies, disease surveillance bodies such as IDSP or Infectious Disease Surveillance Program, and IHR or international health regulations. Therefore, for the smooth functioning of a laboratory like a well-oiled machine, it is important that the administration supports and provides for the requirements of the laboratory, particularly in terms of space, utilities, personnel management, finance, safety, and trainings. Thank you.